When I'm teaching young people, I use an example. And that example is that you can't say slippers. And what that means is that back in the dark ages, when we used to shoot marbles, we used to, just try to shoot them out of a ring, kind of like pool. But if you kind of drop, your major marble, your toy, you kind of drop it, you could say slippers. And then you get the chance to shoot over. But today, we're going to talk about something that slippers ain't going to help you. We're going to talk about colon cancer. And I'm so happy to have with me today Miss Aime Clance, who's an oncology nurse.
Yes, sir.
And we're going to talk about, this is a national, is it Cancer Month or colon cancer?
It is Colorectal Cancer Awareness Month.
It's
March.
Colorectal Cancer Awareness Month. This is a call to action.
A call to action.
I'm your host, Alex Tapper-Sham, and as I said, I'm interviewing Ms. Clance. Now let me tell you why this is close to my heart. Less than 3 years ago, I had a brother that passed from colon cancer. And it's my understanding that although he knew that something was wrong, he did not get a colonoscopy. And I'm hurt today about that scenario. And the reason I'm glad that this is National Colon Cancer Awareness Month, because Miss Aime and I would like to impart some information to you, for you, your mama, your grandmama, your granddaddy, and your friends and neighbors, about the significance of colon cancer treatment and prevention. Ms. Aime?
Thank
Ms.
you.
Aime,
Yes.
how
Thank
you
you.
doing?
I'm good. Thank you for having me.
Well, thank you for coming. And as I said, this is a very, very important subject. But before we talk about cancer, talk a little bit about yourself.
I am an oncology nurse navigator at Navicent Health in the Peyton Anderson Cancer Center, and I specialize in gastrointestinal cancers. So that is the esophagus all the way through. I've been a nurse 19 years, and I'm certified in oncology.
Okay, very good. Now, let's talk about what happens with colon cancer. What goes on in order for a person to get colon cancer?
So what happens is, as people get older, and sometimes it's even influenced by our family history, we have these little growths that will grow in the wall of the colon, of your large intestine, what we call polyps. Sometimes they look like a little mushroom. Sometimes they look a little bit more flat. But those little growths develop over time. And if they stay in there long enough, they will change. And they will turn into precancer, and then they will turn into cancer if they stay in there long enough. Which is why it's so important to have a screening colonoscopy, because if we do that, the doctor is able to go in and snip them right on out. And then if we can catch it early enough, we can actually even prevent it from ever turning into cancer.
Okay, so now, is it automatic that a person will get polyps, or does it just occur in some people?
It occurs in some people. Not necessarily every single person will have one, but it does run in families. I have a family member that she develops polyps, and she has to have a colonoscopy every 3 years. So it does tend to run in families. So if you have a family member, your father, your mother, brother or sister, who have polyps, then very likely you could have polyps also, because it tends to run in families.
Now, are you saying, incidentally, my mother died, from colon cancer also. So you're saying that if you have, they used to say, have they changed that? They used to say every 5 years now. So are they now? Is the suggestion now to do it every 3?
No, sir, the suggestion's the same. If you have a screening colonoscopy, if they can find absolutely nothing and it's completely clear, the doctors usually will recommend to follow up in 10 years. If you have polyps, if they find polyps, they usually say 5 years. Most physicians that I work with will be between 3 to 5 years is what they recommend.
But it doesn't hurt to do it in 3 if you got a family history.
It doesn't. Always go with what your doctor recommends.
Yeah, okay. You know what I'm thinking, don't you? Yeah, well, that's outstanding. So, are there any behaviors that may contribute to polyps and, that might increase the possibility of having polyps?
Things that contribute toward just cancer itself, which what those will turn into, is of course tobacco use, smoking. That does include snuff, chewing tobacco, alcohol. Of course, always contributes to diets high in fat, high in saturated fat, animal products, red meat. I know everybody likes a good steak. But eating a diet high in that does contribute toward colon cancer. So things like your mom always used to say, eat your vegetables, eat your green vegetables, lower fat diet, eating leaner meats, fish, lean chicken, things like that will help lower your risk. And taking care of yourself, exercise is always a big thing, just because that helps your heart, it helps your lungs. It also helps keep your weight down, which reduces your risk, because obesity is also a risk for colon cancer.
Yeah, that's outstanding to know. Well, now let's assume that polyps are found, and let's assume that we did not catch them early enough, and then that there are some cancerous ones. Now, do they go in and try to remove those? I mean, what's the treatment process after the fact?
So if you're a physician, you have a colonoscopy and they find a polyp or a mass, a growth, and they take a piece of it, a biopsy, and it comes back as cancer. What they'll do is you will need to have a CT scan of your chest, your abdomen, and your pelvis, because we need to see what's going on in the body that you cannot see with the camera that the doctor's using. And then they usually will send you to a surgeon, because one of our number one treatments for colon cancer, early colon cancer, is surgery. We remove it.
So if you got it and you get it removed, then it's possible to get well from that?
Absolutely, if we catch it early enough. Yeah. So we usually can't stage colon cancer until after we have surgery. We can tell by the CT scan if it's moved to other parts of the body. But when the surgeon removes part of the colon, he also takes lymph nodes. And then that's how they tell if the pathologist looks under the microscope to see, has the cancer spread to those lymph nodes. And that's how we can tell if it's a stage 1, stage 2, or stage 3. And based on that is if a person needs other treatment. But the cure rate for survival rate, for stage 1, when we catch it as early as we can, is about 90%.
Wow.
So the earlier the better.
So what I need to do is to look at that camera and tell people out there to get checked, get your colonoscopy. Now, what would that process be as it relates to scheduling and getting a colonoscopy? And what does that involve?
So your primary care physician should be recommending, if you're a certain age or your family history, to get one. He will send you to a doctor, a gastroenterologist, or sometimes even another doctor, surgeon, Some surgeons also do colonoscopies, refer you to them to have it done. Many people are scared of colonoscopies because of how they do it, but when you're scheduled to have it
But
done.
it doesn't hurt, does it?
No, it doesn't hurt at all. The worst part is getting ready for it because we have to clean out the bowel.
Oh yeah. Oh
You
yeah.
have to clean it out, otherwise the doctor cannot see anything. And it'd be looking like looking through mud, and that's not pleasant for anybody. So clean it all out, which means you can't eat. You can only have things like chicken broth, Jell-O, popsicles. And sometimes that's really hard for people to do because they're hungry. And then they're having to clean out the bowel. You go to the either the surgery center that day. They put in an IV, give you some IV fluids, and they take you into the room. They give you some medicine, and you're asleep. You don't feel a thing, and you don't remember a thing.
Yeah. So once it's discovered, and then it's removed, do you necessarily have to go through chemotherapy, or is just that removal, the initial removal, good? Is it fine with that?
Usually they will recommend, the doctors will recommend chemotherapy if it's in a more advanced case, so a stage 3. If there's multiple lymph nodes that they find that has the cancer in it, then they recommend someone to have chemotherapy after they heal from the surgery. If they're early in stage 1 or stage 2, frequently the doctors don't recommend it, and the person is just monitored very closely.
Yeah. When you at a later stage, say for example, a person has not had a colonoscopy, and what would be the signs that you may have a problem with colon cancer, though you have not had a colonoscopy?
First, one of the biggest signs is blood in the stool. So it is important to pay attention to your body, to remember your bowel habits. If you notice that there's blood in the stool or in the toilet, that's a big problem, and that needs to get checked and seen. If you have a change in bowel habits and you're having diarrhea all of a sudden for, it's not just because of something you ate one time, but it's continuous, it's going on weeks and weeks, something's wrong. Or if you suddenly have been very regular and then you're having constipation over the same kind of period of time, like, well, this is not normal for me. It needs to be checked. And what it also is if someone who has an unexplained weight loss. They've lost 10 pounds and they're not trying to do so. If you've been exercising, you've been working on trying to meet that goal, but they're not. You're like, well, something's going on. Cancer cells eat more and they eat faster than regular cells in your body. So what happens is that it will basically steal the energy from other places, and so people will lose weight. So that's a big warning sign. The number one is their blood in the stool.
Okay, so if there is blood in the stool, then that means that it's probably a little more advanced than just a regular polyp. Yeah.
And and doctors would also say, well, that could be hemorrhoids. It could be, but it needs to be.
But you need to know that.
You need to know that for a fact,
Yeah.
and it needs definitely don't. I discourage people just to assume, well, it's just a hemorrhoid. Don't assume that. Please tell your physicians, tell your doctors, get it checked, and make sure.
Now, I've seen some advertising that says that it's possible to get examined for colon cancer without a colonoscopy. Some kind of kit where you get a stool sample and send it off. How, based on your knowledge and experience, reliable is that?
The Cologuard is what it is.
Cologuard.
The little dancing box that's on the
Yeah.
TV.
I
So it's a stool DNA test. So what it's looking for is as the stool moves through the colon, through the large intestine, you naturally shed off dead cells. And some of that could be cancer cells or polyp cells. But we have seen that there's like false negatives. We've also seen a few false positives. But if you have a positive, you're going to have a colonoscopy.
If you have what?
If they find a positive on that, you're going to have a colonoscopy. Colonoscopy is a gold standard. I personally encourage.
So what you're saying is that either way, you really ought to just, because it could be negative. Mm-hmm. You're telling me that it could be negative from that color guard?
Well, unfortunately, it's not 100%. I mean, we would love it to be, but it's not. Every test out there, whether it is the Cologuard, or there's also another one called a fecal immunochemical test, which is testing for human blood. You can have false negatives and you can have false positives. It's not perfect. Mm-hmm.
So there is a blood test that possible can detect colon? No,
it's a stool test also.
So,
I wish.
Yeah.
I hope one day that we'll have a blood test that we can do it.
No.
But any screening test that there is, if it's positive, you're going to have a colonoscopy, because it's very important for the doctor to know where it's at. Because if you take the Cologuard, for instance, and it shows up positive, you don't know where, because your colon goes all the way around. So the doctors need to know where exactly it is. So that's when important they do a colonoscopy.
Right.
Because they can tell exactly where it's at.
Now, usually, how long does that process take? Talk about it. You were going to talk about,
Mm-hmm.
The test. Let's just start from point A. You go to the doctor and say you want a colonoscopy. Then what happens?
So then your doctor will refer you to another physician who does colonoscopies, a gastroenterologist, or even possibly a surgeon who does them. We have a few here around the area who do. And you'll go and see the physician. You meet them in person, ideally. You always want to meet your doctor ahead of time. And they'll do like a little physical, a history, and then they'll schedule you for a colonoscopy. And you will go in, you'll have to prep the day before, which means no real food. I tell patients nothing that you can chew, popsicles, Jell-O, broth, those kind of things, water. And then you'll have to take a bowel prep, including medications to clean out your bowel.
Right.
So it can be a long night, the night before, just trying to get cleaned out. And then once you're what we call clear, you go to the bathroom, you have a bowel movement, and it's clear. It's water.
Just water.
Clear water. That's what we want. That's what we want. Because then you'll go in, they'll put an IV in, you'll go into the surgery center, whether it's the one that the physician owns or the one at a hospital, either one. And they'll put in an IV, but that's how we're going to put you to sleep. So you won't feel anything. But we need it to be clear, because the scope is about that big around.
Which is a camera.
Mm-hmm. It's got the camera. So if you're clear, then the doctor can actually see the entire wall of the colon. And so he's looking, or he or she, will go all the way to the end of your bowel, all the way here, and slowly come back, and they're looking for any kind of growth, polyp, anything. And if they see it, they'll remove it.
Now you can remove it with the same tool that you're looking at it with?
Absolutely. The doctor is able to put in a little, what we call a little snare, like a little hook in a way, like a little rope, and it's like a little loop. Okay, and they put it down through the scope, and he can watch it on the camera. He puts it around the polyp, and he pulls back, and it just snips it off. You don't feel anything, you don't remember it. And then they send it to the pathologist, who's going to look under a microscope and tell us what it is.
If a person, what is the survival rate and I know it varies, but just for the sake of conversation. So even if a person now has it and is living with it and does not know that he or she has it, would it still be worth it to go and really find out? I mean,
Absolutely.
is there some healing or possibilities, for want of a better word, even though you already got it?
Absolutely. Absolutely.
So even if a person finds blood in his or her stool, which is a positive factor that he or she may have it, but it's still possible for it to be addressed and healed?
Yes, absolutely. If we leave it in there long enough, it will
Yeah.
it will kill you. And that is not a pleasant. It's not a pleasant way to die. I unfortunately have seen it a lot. Colon
What
cancer.
happens when a person is dying from colon cancer? I mean, that might be kind of discouraging for. That might be kind of encouraging for to go and get a colonoscopy.
Well, what can happen is that, your colon is just like plumbing. And if it becomes blocked, just like if you got a pipe that gets blocked, what happens? It backs up.
Ooh.
Like your sewer pipe, for instance. It'll back up into your bathtub, the toilet, and gets all gross. Well, the body's the same way. If it blocks right here, it's going to come out, and people start vomiting. There's a lot of abdominal pain. That's when a lot of times, sometimes the doctor has to put it in an emergency bag. If it moves to the other parts of the body, the liver, the lung, it causes a lot of problems.
Because it's poisonous.
Yeah. I mean, it's taken, the cancer takes over the body and the rest of the body can't function.
Wow.
If I've heard so many people over the years say, well, I don't want to know. Yes, you do want to know. Because the sooner we find out, the better, and then we can treat you, try to prevent that from happening.
Well, we're going to give some more points of encouragement in just a minute. We're going to take a break. But first, this is a call to action.
A call to action.
I'm your host, Alex Haversham, interviewing Miss Aime Clance, who's an oncology nurse, and we'll be right back to give you some encouragement to go and get your colonoscopy. We'll be right back. Well, we said we began this other part of the show with encouragement. So, what are the statistics as it relates to deaths and cancer rates and survival rates for Georgia, to the best of your knowledge?
Colon cancer is the third leading cause of cancer death nationwide and in the state of Georgia.
So it's the third leading cause of cancer death. What are the other two?
Lung. Lung is a big one. Yes, lung is a very big one. Also, like for women, breast cancer, still, unfortunately. And for men, I'm sorry to say, I can't remember the third one.
That's okay.
But of course, prostate's a big one
Yeah.
for men.
Yeah.
And actually, pancreatic cancers are on the rise, sadly.
Wow.
But with colon cancer, I mean, we can help improve our rates dramatically.
But you deal specifically with colon.
Mm-hmm.
That's your specialty, does it? Not the other ones.
I do. Actually, I specialize in all the GI.
See, you're holding out on us.
So I work with patients who have for cancer of the esophagus, the tube going from the mouth to the stomach, pancreas, liver, colon, and rectum.
Wow. So, what role what are some of the positive things? You told us what not to do.
Mm-hmm.
But are there things that, like foods and
Mm-hmm.
exercises and things of that nature that one can do to help prevent it and or address it, colon cancer?
Biggest things we can do for ourselves. We can't necessarily change our family history. We can't change certain other things like that. but we can exercise walking. That's the biggest thing, is just get out, walk 30 minutes. It doesn't even take, you don't have to go to a gym.
You fussing at me?
No, I'm fussing at myself too, because I'm not going to lie. Sometimes it's a struggle.
Yeah.
But just walking 30 minutes a day. High fiber diet. Lots of vegetables, green vegetables. So broccoli, not everybody likes broccoli. But salads, spinach salad's always a good one because it has high in iron too. But a lot of that fiber, oatmeal. A lot of people like oatmeal. Things like that will help protect. It will help improve our biome in our colon, to help protect our colon. Lower red meat intake. Not saying that you can't have a steak periodically, but do we need to have red meat every day? No. Chicken, lean chicken, fish, things like that. We can work on to help ourselves.
Yeah. Well, I think the moral of this story is that I'm sure Aime agrees with me, we want everybody to live a long life. And I know that, and I've experienced it firsthand with the loss of loved ones. So, we are just strongly suggesting that you do all you can in order to detect and prevent colon cancer. But the best way to know where you are with colon cancer is through a
colonoscopy.
And though there may be some discomfort, I'm not a doctor, I'm just leaning on what Aime is saying. There might be some reluctance because of the food and the prep, that it would be definitely worth it. Because I really believe that my relatives, my brother and my mother, who passed, would be alive today had they gone through that process. We don't want that to happen to you. So I'm saying to you, and she's going to tell you too when I finish, get your colonoscopy.
Get your colonoscopy.
It's very, very important. This is a call to action.
A call to action.
I'm your host, Alex Habersham, having had a very, very important subject, talked about a very important subject as it relates to your health, which is cancer generally and colon cancer in particular. Get checked and live a long life, and don't let not getting a colonoscopy be the reason that your life is not long. Have a great day.